Who are you?
Larry Fears. Robin Walker.
Osvaldo Arribas.
What'd you say?
Osvaldo Arribas.
Cody Fief.
And I'm the cameraman, Garrett.
Thank you. Thank you guys for coming in and listening to my speech. I want you guys to imagine that you're at a grocery store and you're walking down an aisle and there's a woman in the aisle with you and all of a sudden she's on the ground. You don't know if she's passed out, you don't know if she's had a heart attack, you don't know if she's gone into cardiac arrest. Or you're at home visiting your parents and your dad hits the ground, you don't know what to do. So you call 911 and you wait for somebody to arrive. In both those situations, you've just become a statistic. You're either one of two people. You're somebody that knows CPR and gives CPR, or you're somebody that doesn't. So, how do you know if it's cardiac arrest or a heart attack or if they just passed out? And here's my people. Here's your old lady at the store and dad. But if you go into cardiac arrest is an electrical problem. If you have an electrical malfunction in the heart, it can cause an irregular heartbeat. If you have an irregular heartbeat, your heart doesn't pump blood, the oxygenated blood, to your vital organs, your brain, your heart. You can become unresponsive and not breathing within a matter of seconds, and then permanent death can start to happen in a matter of minutes. Each year, 360,000 cardiac arrests happen outside of the hospital setting, with about 88% of those happening at home. So the chance of you knowing somebody that goes into cardiac arrest is pretty high. You're more likely for it to happen at home or at work instead of being out somewhere. The next one is a heart attack. A heart attack is a circulation problem instead of an electrical problem. With a circulation problem and a heart attack, the blood flow through to the heart is blocked. So the area of the heart that the blood is not getting to starts to die off. If that happens, some symptoms that can occur is discomfort in the chest area, shortness of breath, heavy sweating, nausea or vomiting, numbness in your arms. Normally it's the left arm. And then in women, sometimes they get pain in the jaw or the back. Symptoms of a heart attack can be present for days. They can also be present for weeks. And if you have symptoms like that, it's a good idea to get into the doctor, because they are able to, a lot of times, unblock that artery and get that oxygenated blood flowing back into the heart. And your heart normally doesn't stop during a heart attack. And these are all according to the American Heart Association and findings that they have found. So if you have a heart attack that doesn't normally stop your heart and cardiac arrest that does stop the heart, a lot of times we have to ask, are they connected? The majority of heart attacks do not actually lead to cardiac arrest. But a heart attack can increase your chance of cardiac arrest. When cardiac arrest occurs, a heart attack is usually to blame, and that usually happens right after a heart attack or during the recovery of a heart attack. It can happen, hours, sometimes even days later after a heart attack. Other heart conditions that can affect or cause cardiac arrest is heart failure, cardiomyopathy, which is a thickened heart muscle, and arrhythmias, which are irregular heartbeats. Some statistics for CPR and cardiac arrest that I found really interesting, and these are according to the American Heart Association and vfibs.com. 70% of people don't know what to do in the case of a cardiac emergency, which is very unfortunate because 4 out of 5 cardiac emergencies occur at home or at work. In less than 8% of those cardiac incidences, Less than 8% will survive if that cardiac incident happens outside of a hospital setting. So that's really a poor number. Brain death begins 4 to 6 minutes after cardiac arrest, and permanent death can occur anywhere from 8 to 10 minutes after cardiac arrest. If a person receives effective CPR, their chance can double or triple, which raises their chance of survival to 15 to 24%, which still seems kind of low, but that's a lot better than just 8%. But that's only effective CPR, and that's if they receive that within 1 minute of going down. So a lot of times people who are unattended when they pass out, they don't get that attention for at least a few minutes, and sometimes it can be hours, and then it's too late. If an AED is used within 1 minute, their chance of survival increases to 90%, which is why a lot of schools, big corporations, a lot of big businesses have AED machines inside their store, in their location. That way they can get that. Also, a lot of police now carry small units, so when they respond to an emergency, they can apply an AED right away. 32% of people who go into cardiac arrest receive CPR from a bystander. And the reason for that goes back to only about 70% of people actually know how to give CPR. So it kind of, is a cycle. If we don't know how to give it, we're not going to give it, or if we're unsure, we're not going to give it, and then their chance of survival is even less than 8%. So what exactly is CPR? Well, CPR is cardiopulmonary resuscitation, and it's an emergency procedure performed to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing to a person in cardiac arrest. That means that we're pushing the blood back through the veins to get the oxygen moving, to get to our organs, to get to our brain, to get to our lungs. Some history on CPR. In 1741, the Paris Academy of Sciences recommended mouth-to-mouth resuscitation for drowning victims. So CPR originally started in the early 1700s. In 1891, Dr. Friedrich Maas performed the first documented chest compressions in humans. In 1960, Dr. Peter Safar, James Jude, and William Bennett Cohenhoven decided to combine mouth-to-mouth and chest compressions, which gave us the actual CPR that a lot of people have been taught. And previously, CPR was only used in healthcare settings and by healthcare professionals, but nowadays it's so easy to do that even kids can learn it, and young kids are being taught CPR. So if anyone can do CPR, why don't they? And some of the reasons are people are afraid of being sued. If the person dies, they're afraid that the family might come back and sue them. But most states have adopted a Good Samaritan law that protects people from that lawsuit as long as they attempted to render aid, that wasn't beyond their means. If somebody who had no health training tried to intubate a person, they could be sued because they absolutely didn't know what to do. But if you're just trying to give CPR, that Good Samaritan law is going to protect you. Fear of catching a disease from mouth to mouth. In all the history of CPR, according to the National Institute of Health, only 15 cases of transference is actually documented. And that's because people had open sores or active bleeding to where there was that transference. Also, the AHA, which is the American Heart Association, they currently recommend a hands-only CPR, so you're no longer giving ventilations or breathing into a person. And then fear of performing CPR incorrectly. With that fear, if you don't perform CPR, you basically help contribute to that person's death by failure to act. So it's always better to at least make an effort than just stand by and let them die. Now, as I stated, the AHA recommends hands-only CPR. So I know a lot of you guys are probably thinking, I don't have to put my mouth on a person, because, which he's pretty handsome, I think. Yeah. But you don't have to worry about somebody sticking their mouth on you. Not that you would be if you were dying, but you don't have to breathe for somebody. Hands-only CPR is just as effective, if not more effective, in adult-only CPR. So how can it be more effective? Most ventilations, when you breathe for somebody, end up in the stomach instead of in the lungs. So they're not getting that oxygen into the lungs anyways. Also, when you stop compressions to ventilate, it takes around 10 compressions to get the oxygenated blood going again. And so if you give 30 breaths or 30 compressions and stop to give 2 breaths and then have to start up again, you've wasted time where there's no oxygenated blood getting to the brain. So they've just gone that time without any oxygen getting to any of their vital organs. So by doing the hands only compressions and CPR, that oxygenated blood is constantly moving through the body. So how do you do hands-only CPR? You want to make sure that the person is on a hard, flat surface. They don't want to be on a bed because the bed would have some gifts. So it'd be on the floor. The heel of your hand is going to go in the middle of their chest on their sternum, between the nipple line. The other hand goes on top. So when your hands are down, you can lock fingers, but you want to use, the palm of your hands. Pressing straight down using your upper body, you're going to keep your arms straight and press down at least 2 inches. You're going to give 100 compressions per minute. And a lot of people ask, how do we know what that is? Well, it is the beat of either Staying Alive by the Bee Gees, or, in really bad humor, Another One Bites the Dust by Queen. They both have the same beat, and it's 100 compressions per minute. In EMS, we actually use Another One Bites the Dust because the statistics for survival is so bad. But that's sad. You're going to continue compressions until either help arrives, someone relieves you, or you are just physically exhausted and you can no longer continue. Once you start compressions, you cannot stop, or that is abandonment, unless you're physically exhausted. So if you were to ever have to give CPR to somebody and give compressions, a lot of times people wonder what that's like. If you guys have ever taken a Dorito bag that has been opened but still has Doritos and crushed it, that's what CPR initially sounds like. That is the sound of the cartilage ripping away, and it sounds like broken Doritos. So, yeah, next time you have Doritos, open it, squeeze the bag, hear that crunch, that's cartilage. You can also expect broken ribs. When you give somebody CPR, some of their ribs may break. And then also possible lacerations to different organs, especially the lungs. You can pierce them. But I see some faces going, oh my goodness. Makes you wonder, is it worth it to even attempt CPR? And the answer is yes. Without attempting CPR, they are going to die. If you attempt CPR, they have a better chance of survival, and the injuries that they can sustain from the CPR, like the broken ribs, the broken cartilage, and the lacerations, 99% of those are non-life-threatening, so they will recover from that. It also varies depending on if you're giving CPR to a child, an adult, or an elderly person. If they have very brittle bones, then unfortunately you can also break their back or other things. But it's another thing you have to remember. If you don't give CPR, they're dead anyways. So you have to really, there's not really any weighing it. So, whether you're in your home or out in public, there are 4 out of 5 chance that somebody that is going to need CPR, and that's why it's important to know the hands-only CPR, so that way you do have a chance to save the life of somebody that you're related to or somebody that you work with. Lastly, there's a short 1-minute video that kind of shows you the hands-only CPR. So I will attempt to play that. Just bear with me.
Kinda. you see a teen or adult suddenly collapse, the first thing you do is...
Call 911.
And the second thing you do is...
Push hard and fast in the center of the chest at a rate of at least 100 beats per minute.
Who even knows what 100 beats per minute sounds like?
Remember, it's only 2 steps. Call 911.
And push hard and fast in the center of the chest to the beat of Staying Alive until help arrives.
Catchy little tune. So, thank you guys very much. I appreciate your time.
This has been a presentation from Jen and Will. Thank you for stopping by.